Basically, epilepsy is a common neurological disorder which is most commonly found in India. There are many myths about the epilepsy, and we have to differentiate the epilepsy from the seizure. Basically, epilepsy is what? Epilepsy is a disorder which is characterized by the recurrent, which you can see in this chart. It is a recurrent episodes of the electrical impulses from the brain. This is known as epilepsy. There is a major difference between the epilepsy and seizure. Basically, seizure is the characterization of the epilepsy. Seizure is a type of epilepsy, but all seizures are epileptic, but all epilepsy is not seizure. In the seizure, we have basically a clonic posturing of the body or any frothing from the mouth. Basically, seizure is the presentation of epilepsy. There are many types of seizures which we can see, and we have to discuss about the causes of the epilepsy and going to about the treatment of the epilepsy. The epilepsy, if we go to the 100%, then 70 to 80% in the epilepsy there is no cause present in the epilepsy, but 30 to 20% there are causes like head injury, any intracranial hemorrhages, any electrolyte disturbance. There are causes which are related to the brain or which are related to the systems like the hypoglycemia, hyponatremia, electrolyte disturbance. They are the non-CNS causes of the epilepsy. But CNS causes we can see tumors, brain hemorrhages, CVA, and other causes like subarachnoid hemorrhages, aneurysm. This can lead to the epilepsy. Trauma is the most common cause which can lead to the epilepsy, and it is known as post-traumatic epileptic seizure. Now we are going to the type of epilepsy. Type of seizure which are present is there are two types of seizures. It is generalized seizure or partial seizure. Generalized seizure are those seizures where there is a tonic-clonic activity followed by loss of consciousness. But in partial seizure, there can be a tonic activity or clonic activity in any part of the body, but without loss of consciousness. Now, generalized seizure can be of many types, like GTCS, generalized tonic-clonic seizure. It can be atonic seizure, where there is a loss of tone in the body and patient fall down suddenly. There can be a clonic seizure, where there is only a movement in the body. There can be absence seizure. In the absence seizure, there is for a brief second of time, patient can have a loss of consciousness for that moment, and he suddenly stop working, but there is no fall down in the absence seizure. There can be a myoclonic jerks which are more common in the childhood age group. Now coming to the partial seizure. Partial seizure is any activity which is not generalized. It is either in any limb or in the face. Now partial seizure can become generalized seizure. So it is known as partial seizure with the secondary generalization. As we have already discussed the causes of the seizure, it can be CNS cause or it can be non-CNS cause. Now, as we can see in this chart, the symptoms that indicate a seizure disorder, they can be a blackouts or confusion memory after the seizure. After seizure, patient can have post-ictal syndrome, post-ictal concussions, post-ictal status, where there can be a sudden weakness of any part of the body, sudden loss of the memory, or can be blackouts which can be present. There are certain conditions which can trigger the seizures. Like suppose if any patient is on the epileptic drugs, if he miss the drug, it is the most common cause of the seizure. Any hormonal changes, any dehydration, any photosensitivity, some seizures are photosensitive, any sleep deprivation or any type of stress which can lead to seizure disorder. Now we are coming to the myths related to the seizure in India. Basically in India, mostly the poor peoples or the educated peoples are also in the villages or in the city. Basically they treat seizure as a कि भगवान ने जैसे कोई देवी देवता आ गए. तो इन इंडिया इट इज़ मोस्ट कॉमन कि व्हेन हम जब कैंप करने जाते हैं गांव में या किसी भी जगह इंटीरियर्स में कैंप करने जाते हैं, तो वी फाउंड लॉट ऑफ पेशेंट ऑफ द सीजर विच आर नॉट टेकिंग ड्रग्स, विच आर टेकन ड्रग्स एंड नॉट ट्रीटेड प्रॉपरली, एंड they left the treatment and gone to the Devi Devta for their pujas. After that also there is no improvement in the seizure. तो इंडिया में देवी देवताओं का चलन आज भी, जिसको बोलते हैं दौरे की शिकायत में, बहुत ज़्यादा है. इस कारण से मैक्सिमम ऑफ द पेशेंट आर इग्नोर्ड और ट्रीटेड partially for the seizure, and for this reason there is increase in the activity day by day of the seizure because of their ignorance. So we should treat them or literate them about the seizure activity, और उन्हें समझाना पड़ेगा कि this is not a any भगवान के द्वारा दिया गया कोई ऐसी देवी देवता नहीं है. ये दिमाग की या दिमाग के बाहर की एक बीमारी है जिसका कि इलाज आज अवेलेबल है, क्योंकि बिकॉज वी हैव नाउ लेटेस्ट ड्रग लाइक लेटेस्ट वी हैव लेवेरसेटाम which is the newer drugs added in the all the anti-epileptic drugs had a good result. So now we are going to tell about the treatment about the seizure. What we have to do? Firstly, we all have to do first aid in the seizure. Suppose आप कहीं जा रहे हैं, आपके साथ कोई जा रहा है, अगर उसको आपने देखा कि उसको दौरा पड़ा, तो फर्स्ट ट्राई टू calm down and not to grasp him, let the seizure come, but उसके जो दांत हैं और जबान है, मोस्टली इन सीजर जबान जो है दांतों के बीच में आके कट जाती है, जिससे कि खून ब्लीडिंग शुरू हो जाती है. तो आप उसको ट्राई करें कि उसके दांत भींचने से पहले या तो कोई चम्मच है या कोई ऐसी चीज़ जो वो काट ना सके, वो उसके उसमें दांतों में फंसा दें, जिससे कि उसकी जबान उसके दांतों में ना अड़े. और उसको ये चप्पल सुखाने और ये कुछ ना करें, क्योंकि इससे कोई सीजर एक्टिविटी रुकती नहीं है. After the seizure control, after the seizure, you try to take him to the hospital and consult the neurophysician or neurosurgeon or the general physician who is available at that time. Or don't take him to the देवी देवता और कहीं और ना ले जाएं, जिससे कि पाठ पूजा कराने के लिए ना ले जाएं. ठीक है. Now we come to the treatment of the seizure. First line of treatment for the seizure is medication. There are many anti-epileptic drugs, benzodiazepines, barbiturates, which are available to take treatment of the seizure. Three line of treatment of the seizure are available: medication, surgical, and the non-pharmacological treatment, which is known as ketogenic diet है, vagal nerve stimulation है, and the life modification. Now firstly I would like to tell about the treatment of the seizure by medication. For the partial seizure and generalized seizure, there are different medications available. For the partial seizure, mostly levetiracetam or phenytoin, they are the best drug for the treatment of the partial seizure. Now we come to calculate the dose of the anti-epileptic drugs, which is calculated according to the weight of the body. Now for the generalized seizure. For the generalized seizure, sodium valproate is the drug of choice, but in case if we required a multiple drug treatment or 1 or 2 drugs or 2 or 3 drugs which can be added if the generalized seizure is not stopped by single drug, then we can go for the newer anti-epileptic drugs which are available, which are less toxic to the liver and which are safe in the childhood also and now the pregnant lady also. So we can add the levetiracetam or the phenytoin or the oxymazetol, oxcarbazepine, which is the oldest anti-epileptic drugs available. Now we will talk about the treatment of the anti-epileptic drugs in the pregnant lady. Generally in the pregnant lady, there is a trend, if she is taking a treatment before the pregnancy, then we have to continue the same drug. But in case if we notice the first seizure in the pregnancy, then now initially we gave the phenytoin, but now we can use a more safer anti-epileptic drugs which are available with us is levetiracetam, which we can use in the pregnancy, which is not harmful to the mother and the child, because anchorate can lead to the neonatal malformation in the pregnant lady. Phenytoin can also lead to the neonatal malformation in the pregnant lady. But if he is taking it before the pregnancy, then we have to continue the same drug. But if we had to add a new drug, then we can add a levetiracetam, which is a newer drugs of the anti-epileptic. So I would like to convey a message: seizure is not a भगवान की कोई दी हुई ऐसी नहीं है कि जिसको कि आप पाठ पूजा से रोक सकें. इसका दवाई में आज मेडिसिन से, सर्जरी से इलाज संभव है, तो इसका इलाज कराने की कोशिश करें और मैक्सिमम से मैक्सिमम आप सीजर के लिए डॉक्टर से या जो भी आपके जनरल फिजिशियन, न्यूरोफिजिशियन, न्यूरोसर्जन जो भी अवेलेबल हो उसको कंसल्ट करने की कोशिश करें. द लास्ट ट्रीटमेंट ऑप्शन इफ सीजर डजंट कंट्रोल बाय एनी एंटी-एपिलेप्टिक ड्रग्स इज द सर्जिकल ट्रीटमेंट, which is the last option, which is only required in the 2 to 5% of the cases of the seizure disorder.